Coming up on Network Africa. South Africa, new cases double in 24 hours as Omicron variant spreads and the WHO deploys a search team to Gauteng province. African Union and United Nations jointly criticized travel restrictions on southern African countries, warning this could lead to travel appetite. Plus, UN humanitarian chief says a total of 274 million people worldwide will need emergency aid and protection in 2022. Hello and welcome to the program. I'm Layo Adegoke. We continue our coverage of the Omicron variant in South Africa. Health officials say this new variant has now become dominant in the country and is driving a sharp increase in new infections. Some 8,500 new COVID infections were registered in the latest daily figures. That is almost double the 4,300 cases confirmed the previous day. According to the World Health Organization, Omicron has now been detected in at least 24 countries around the world. The health body is now deploying search team to South Africa's Gauteng province. South Africa was the first country to detect the highly mutated new variant. Its National Institute for Communicable Diseases had said more than 70% of all the virus genomes it sequenced last month have been of the new variant.
We are also working closely with countries to step up response to this new variant. In South Africa, where WHO has already a team working in genomic sequencing, we are deploying a surge team in Gauteng province to support surveillance and contact tracing. Africa has made little inroads in the path to providing vaccine protection. So far, only 102 million Africans in Africa, or 7.5% of the continent population, is fully vaccinated. More than 80% of the population has not received even a single dose. This is dangerously wide gap.
Quite a very good number of countries now that have been upping up their sequencing activities. So far, we can look at about 50% of, overall 50% of African countries that are able to produce their own sequencing data.
In the meantime, neighboring Botswana's president has spoken against the travel bans imposed on southern African nations over the fears of Omicron. President Mogwetsi Masisi calls it unfair and unjustified, adding that his country is constantly monitoring COVID-19 detection indicators and they remain stable, especially because over the last 3 months, Botswana has experienced a decrease in infections and deaths.
The response by some countries to our detection of the Omicron variant is unfortunate, as it appears to have caused unnecessary panic amongst the public across the world. Similarly, it defeats the spirit of multilateral cooperation in dealing with this global pandemic. The decision to ban our citizens from traveling to certain countries was hastily made and is not only unfair, but is also unjustified while reducing confidence on the reason and logic that prevails. The harshness of the decision has the effect of shaking our belief in the sincerity of declared friendship and commitment of equality and economic prosperity for us. Following the discovery of this new variant, we are carefully monitoring all our key COVID-19 pandemic indicators as prescribed in our national response plan, such as flu clinic visits, COVID-19 hospitalization rate, laboratory positivity rate, disease burden per 100,000 persons, and isolation bed occupancy.
Meanwhile, a top official in Botswana's health ministry says the majority of Omicron cases detected there in the country are asymptomatic, adding it is unfair to treat her country as ground zero for the new coronavirus variant. Pamela Smith-Lawrence, Acting Director of Health in the Ministry of Health and Wellness, adds that 1 or 2 people might have had a few mild flu-like symptoms from a total of 19 cases identified so far.
Out of a total of 19 of these cases, including the first 4, 14 were foreign nationals, and we only had 5 who were local residents and citizens. So far, what we are seeing from most of the contacts of these first 19 cases, most of them have tested negative, and we are continuing to follow them up during their quarantine period to say, on completion of quarantine, have they actually incubated the virus? But so far, all the contacts have tested negative, and most of the cases themselves, really, nobody had any symptoms. 1 or 2 people might have had a few mild flu-like symptoms, but resolved in 1 or 2 days. But the rest, really, nobody has been symptomatic. And I think for now, it is a good sign. But unfortunately, this has been pinned down, and finger now points to Botswana to say it originates in Botswana, or it is a Botswana variant, which I think is quite unfair and unnecessary at this time, because scientists and health experts do understand that by the time you actually detect a variant, it has probably been there in different populations 2 to 3 months even earlier.
The African Union and United Nations are jointly criticizing travel restrictions put on several southern African countries following the discovery of the Omicron variant. UN Secretary General Antonio Guterres warns that the restrictions could lead to travel appetite, describing them as deeply unfair, punitive and ineffective in stopping the spread of the variant. He says Africans should not be collectively punished for sharing health information with the world.
The people of Africa cannot be blamed for the immorally low level of vaccinations available to them, nor should they be collectively punished for identifying and sharing crucial science and health information with the world. With a virus that is truly borderless, travel restrictions that isolate any one country or region are not only deeply unfair and punitive, they are ineffective. We have the instruments to have safe travel. Let's use those instruments to avoid this kind of, allow me to say, travel apartheid.
Molecular virologist Akiala Ishaku joins us now for more on this. Thank you so much, sir, for speaking to us on the program. Well,
Thank you for having me.
We've heard various notions from international and local scientific experts with regards to the severity of this Omicron variant. How concerned should we be, especially as Nigeria confirmed its own first case of this variant?
Yeah, we should be concerned as a country because although the variant that has been, sequenced in people present less severity among younger people, but we don't know what this variant does in older population and also in children. So it calls for caution. It calls for us to strictly adhere to the non-pharmaceutical interventions of wearing of face masks and washing of hands, and also avoiding overcrowded gatherings. But it also calls on us as a country, most especially on the Nigerian Center for Disease Control, to do a lot of surveillance. So we need to activate our surveillance framework and make it active, not passive. And attention should be more on inbound travelers. And we can also do a lot of work among even circulating strain. Layomi, I strongly believe that we still have circulating strain that might be different from the Omicron variants. This is because of climatic weather changes. In fact, this is because we have not also sequenced, we have not also done research to look at even our pets, our animals, whether they are infected with this virus or not. So it calls for a One Health approach. We'll look at the environment, we'll look at the health component, we'll also look at the human. So it calls for concern for us to actually be precautionary in nature and also increase the level of advocacy among Nigerian population.
Well, this new variant has been detected in at least 24 countries around the world. That's according to the World Health Organization. Now, most countries on this list are non-African countries. Yet these nations are not subjected to the same stringent travel restrictions as we've seen on South Africa and other southern African nations, which is already taking a toll on their economy. How does this come across to you?
Yeah, it is unjustifiable, just like the Botswana president said. It is uncalled for. And I think scientists in Botswana and South Africa should be applauded for even coming up with announcing this new variant. In fact, the Netherlands, the Dutch government health services came up to say that we identified this in the early days of November. So it is not the South Africa and Botswana that first identified this. But I think that scientists in Africa needs an encouragement, most especially when it comes to the health sciences. So I think the travel apathy is unjustifiable. It doesn't have any scientific basis. This is the time for African government to place a demand before the table on vaccine equity. This is because we need to also, because if we don't have vaccines for this, no country in the world is safe. So it is time for us to harmonize our thoughts together, our agenda together, a continental agenda on vaccine equity, and begin to place it on the table so that there should be equal distribution of these vaccines so that the world will be safe from this pandemic. If not, no country is safe without equitable distributions of vaccines.
All right, then. Thank you so much, Dr. Akiala Ishaku, molecular virologist. Thank you for speaking to us.
Thank you for having me.
We're moving away from COVID-19 stories now to politics. Cameroonian opposition leader Maurice Kamto was on Wednesday detained at a hotel in the country's largest city, Douala, where he was scheduled to launch his latest book. The leader of the movement for the Renaissance of Cameroon missed his book signing at the hotel, eliciting concern from his supporters. However, his special advisor, Albert Zongang, told local media that he had spoken to him on the phone and he was fine. Mr. Kamto's movement was restricted by the police under instructions from his advisor, termed as a mysterious order giver. The opposition leader has in the past been detained and arrested by authorities. In some of the instances, he was charged in court for various offences that government critics said was unfair targeting of opposition figures. The UN Humanitarian Organization has launched its 2022 Global Humanitarian Overview, GHO, in Geneva. It shows that a total of 274 million people worldwide will be needing emergency aid and protection next year. That is a 17% increase compared to last year. UN Humanitarian Chief Martin Griffiths says that amount is equivalent to the world's fourth most populous country. The document, published annually by the United Nations and partners, includes 37 response plans covering 63 countries. It estimates that $41 billion is required to provide relief and protection to the 183 million people most in need.
For 2022, that there will be 274 million people in need of humanitarian assistance. That's up by 17% from 2021. And to give it a different look, it's equivalent to the world's fourth most populous country. We aim, through this programme, to help 183 million, the most vulnerable, again an increase from last year, and for this we're looking for a record $41 billion for the world's humanitarian needs of the most needy in 2022. The drivers of need are ones which are familiar to all of us, tragically. It includes protracted conflicts, political instability, failing economies, which is something which has been very much to the forefront of our thinking in the last months, the climate crisis, not a new crisis, but one which urges more attention, and of course the COVID-19 pandemic, of which we have recently been reminded that it has not gone away.
Still to come on the program. It's day one at the African Economic Conference taking place in Cape Verde. We'll give you more details after the break. Please stay with us. Welcome back to the program. The UN mission in the Democratic Republic of Congo has said it welcomes regional cooperation to tackle cross-border threats. The comments come after the DRC and Ugandan armies launched a joint operation on fighters from the Allied Democratic Forces after it was accused of carrying out suicide bombings in Uganda's capital, Kampala, last month. The two armies are carrying out a ground and air operation against the rebels. The UN has had a huge presence of troops in eastern DRC for the past 2 decades. But earlier this year, demonstrations shook the towns of Goma and Beni as people called for an end to their operations, saying it had proved ineffective in efforts to achieve stability. Well, the Security Council is scheduled to decide on the 6th of December whether to extend the mandate of the mission. A survey conducted by Ethiopia's Amhara regional government has revealed that the Tigray People's Liberation Front carried out massive destruction and looting in 5 zones of the region. The Regional Planning and Development Bureau, which coordinated the survey, said it had occurred in areas the rebels still held and in areas retaken from them. The TPLF is yet to comment on the allegations, but in the past, they've denied similar accusations. Officials say the total cost of the destruction is estimated to be around 280 billion Ethiopian birr, but the amount is likely to rise as more reports come in. The survey covered 45 districts in 5 zones, and it did not include the big city of Dessie or the industry hub of Kombolcha. The destruction is said to be severe within the agricultural sector. South Sudan's government has promised to end child marriage by 2030, in line with the African Union's campaign to end child marriages in the continent. Paramount chiefs from 10 regional states and 3 administrative areas met in the capital Juba for the 2nd National Conference on Ending Child Marriages. Among the proposals suggested at the conference include one from the Swedish ambassador for a law criminalizing child marriages. South Sudan is one of 40 countries in the world with the highest rates of child marriages. A survey conducted in 2010 found that about 7% of girls marry before the age of 15 and 40% before the age of 18. The 2021 edition of the African Economic Conference has opened in Cape Verde with the theme Financing Africa's Post-COVID-19 Development. The forum, jointly organized by the African Development Bank, the Economic Commission for Africa, and the United Nations Development Programme, brings together various political and business leaders. While speaking during the opening ceremony, UN Deputy Secretary General Amina Mohamed says Africa cannot recover from COVID-19 alone, as a worldwide unity is needed. She adds that before the pandemic, Africa was basking in sustainable economic growth, but the virus disrupted that.
The theme for this year's conference, Financing Africa's Post-COVID Development, speaks to the challenges and the opportunities we face amidst the global pandemic. While the health impact of the pandemic has been relatively muted across the continent, African economies will take much longer to recover than their counterparts in developed countries. This is partly because vaccine coverage is at just 6% across the continent. Vaccine inequality could cost African countries as much as $14 billion every month in lost growth and investments. The United Nations stands together behind the WHO Global Vaccination Plan to secure vaccines reach 70% of all people in all countries by June 2022. Africa has many fundamental strengths, from its young population and natural resources to the Africa Continental Free Trade Area. Before the pandemic, Africa enjoyed sustained economic growth for more than a decade. But Africa cannot recover from COVID-19 alone. We need global solidarity, demonstrated through deep debt relief and increased concessional finance. African countries themselves must maximize resource mobilization to enable investments in social protection, infrastructure, and technology. They must also end the illegal outflow of almost $90 billion annually from bad resource contracts and corruption. We need to see concerted efforts to reduce borrowing costs for African countries and to engage with non-traditional sources of development finance, including the private sector and remittance flows.
United Nations High Commissioner for Human Rights, Michelle Bachelet, has called for an investigation into human rights violations in Burkina Faso. Ms. Bachelet, who is visiting the Sahel region, left Burkina Faso for Niger on Wednesday. Well, during her Burkina Faso visit, she met President Roch Marc Christian Kabore, who she asked to ensure those violating human rights are brought to justice. She also opened a UN rights office in the capital, Ouagadougou, to monitor the security situation. Well, we have joining us now our Channels TV correspondent Amarachi Ubani to speak to us more about the 2021 African Economic Conference that opened today. Hello, Amarachi, good to see you. What can you tell us about today's ceremony?
Well, Layo, as you can see behind me, the whole place has emptied out, and that's because everyone has gone for lunch. We're the only ones here because we had to do this, knowing how important it is to bring you updates on what's been going on. So a session held here just a while ago, about an hour, and the focus was on the financing of long-term development trajectory for developing countries. And there were a few case studies. There was Nigeria, there was Senegal, there was Ethiopia, and then there was this really interesting question from the audience. Someone asked, whether Africa really was looking for a solution for Africa, for the different countries in Africa, and if the solutions really are tenable. So that was a pretty interesting session. All morning so far, there have been two panel conversations that have been going on here. The first one was the one that was had in the morning. It was a high-level dialogue of development partners. The president of Cabo Verde was here alongside some other representatives from UNEC, from the Africa Development Bank, and the UNDP. So it's been a pretty full and interesting morning. Everything, talking about, how Africa can get out of this pandemic, because the coronavirus pandemic has hurt the economies of many countries so much that right now, Africa is like, we need to move forward and we need to finance other aspects, of our countries. That's been the focus. Layo.
All right, then. Thank you so much, Amarachi Ubani, our Channels TV correspondent. And that's all we have for you on Network Africa for today. Thank you so much for watching. I'm Layo Adegoke.